A CDC Advisory Panel convened Wednesday to address pressing coronavirus vaccine concerns. Rare cases of heart inflammation in younger vaccinated individuals were front and center. Experts say there is a, quote, likely connection between the two. Still, they say that the benefits of those shots outweigh the risks. Health officials are urging young people to get vaccinated as the more contagious Delta variant spreads in 49 states. Omar Villafranca is in Missouri, where cases are already on the rise.
Tonight, the FDA is adding a warning to Pfizer and Moderna vaccines as the CDC Advisory Panel is confirming a link between the vaccines and rare cases of heart inflammation in teens and young adults. The CDC tracked more than 1,200 cases, most occurring after the second dose, more linked to Pfizer and the vast share in males aged 24 or younger.
I woke up at 2 a.m. with chest pain.
16-year-old Noah Hires was rushed to the hospital just 2 days after receiving his second dose.
I was terrified as we were driving there, and Noah said, "Mom, it's getting worse, and these chest pains are really terrible." I was just praying.
Symptoms of myocarditis include chest pains, heart palpitations, and shortness of breath. But a new CDC report estimates the vaccines could prevent 5,700 COVID cases among 12 to 17-year-old boys and as many as 215 hospitalizations. The benefits still clearly outweigh the risks.
This experience was much better than getting COVID and much lower risk of anything long-lasting occurring.
The Delta variant and vaccine hesitancy continue to drive new COVID cases. Tonight, Missouri with the highest rate in the nation. Just 1 in 4 adults fully vaccinated in some areas.
It seems to be dive bombing everybody.
Louis Michaels and his wife Patty, both unvaccinated, are both now recovering in a region where COVID patients in the ICU are up nearly 300% in the last month.
Get this shot now and bypass what we've been through the last 2 weeks, because you feel like you're going to die. It's horrible.
Dr. Terrence Coulter says most of his new COVID patients are young.
I was hoping for a good summer, and we're just planning for a rough summer.
Dr. Coulter also told me another concern of his is the busy tourist season in nearby Branson. Water parks and shows will be jam-packed. He's worried that could lead to super spreader events, which in turn could flood the hospitals. Lana?
Oh my gosh, we wish we were beyond that. All right. Dr. Hlatshwayo Davis joins me now. She's an infectious disease physician at John Cochran VA Medical Center and a member of the St. Louis Board of Health. Dr. Hlatshwayo Davis, great to have you back on. You know, it's so frustrating, I'm sure, as a medical professional to see those case numbers on the rise again. And as vaccine rates tumble, the head of the CDC says that nearly every death from COVID-19 in this country at this point is, quote, entirely preventable. How do you feel about this news?
It's really disappointing, Lana. I mean, it's been a long year for all of us, right? And so much work has been done to produce a vaccine that is, quite frankly, a triumph of science, that is highly efficacious, extraordinarily safe. And then December came, and these more concerning variants came into play, and now with the Delta variant here. And so for those of us, and especially in the infectious diseases area and in public health, this couldn't be a more pivotal time for us to make clear how important the vaccine is, because we are seeing in areas where the Delta variant has a larger grip than it has in the U.S. And let me be clear, we fully expect it to be the dominant variant by the end of July. In countries like the United Kingdom, it accounts for 90% of new cases. And we know that folks who get both shots of the vaccine have a high level of protection, but folks who get even one shot or none do not. And so for me, this is absolutely a matter of life and death.
And yet, there are headlines that continue to give people pause about getting the vaccine. So I want to dig into those with you right now. Let's talk about that CDC Advisory Panel saying that there is a, quote, likely association between the mRNA coronavirus vaccines and heart inflammation. Talk to us about how these two might be connected, and then also tell us how concerned we should be.
So let's break this down and put it in context, right? Because I think folks, when they get news, they assume that they're being given the news because it's terrible news and they should be concerned. What I've been proud of throughout the last year has been, especially since January, the administration's openness and transparency with the public. They have released information as it's come. They have made sure we understand what is going on. But that doesn't necessarily mean that they're releasing this information because we should be in fear. Let's take this information about myocarditis. And what I mean by that is inflammation of the muscle of the heart, right? And there have been cases associated with the vaccine. To put that in context, we're looking at 12.6 cases per million people. In the general population, one has a much higher rate. We're talking about per 100,000, 10 cases per 100,000 just in the general public. With COVID, if you get COVID, you have a high chance of getting a bunch of other syndromes, including myocarditis. So this is not to say that this is exclusive to the vaccine, but it is transparent in providing this information, by the way, that shows a likely association, but certainly not causation. We can't prove that there's a direct link as of yet. But it gives us information and allows us to prepare our hospital systems for these few cases when they do arise. The ones that have arisen, 80% of those folks have been fully recovered, and only 2 have wound up in an ICU with 0 deaths. And so for me at this point, this is no concern, no need for panic, just to continue to be aware and to trust that our leaders will continue to be honest and transparent with us as information arises.
And meanwhile, we're also awaiting a pediatric vaccine for younger children. What do you know about the approval process that ordinary parents might not know that makes you confident that these shots are going to be safe for our children?
Well, what makes me confident is that we did this the right way. We did this in adults. We did this in a large number of adults, which gives us a large degree of information to give us the comfort to move forward with the pediatric cases. We know that preliminary data from these studies are already showing high efficacy and safety. And we believe that there will be enough data to start to discuss emergency use authorization as early as September, so that in the fall, and certainly by the end of the year, we can start really talking about vaccinating all children if the data is amenable to that, which we all have a high degree of confidence it will be. So that is very, very, very it makes me feel very confident about this process for our children, because parents have had a tough time of this. You know, as a mom myself, making the decision about when kids can go to school, then having concerns, with what to do with kids in social setting, with summers coming. I think we all want to see every single human, not just every single adult, but every human, our children as well, vaccinated as soon as possible.
Let's talk about booster shots, because earlier Wednesday, the head of the CDC said that they are planning for booster shots. What kind of data is needed before officials can decide on a timeline for these extra doses?
Well, since we've been giving vaccines, we've been following, we've been doing a lot of research to see how people are responding. And based on a number of things, the case positivity rate, how we're doing both nationally and globally. And again, as we start to see a resurgence in cases, especially in places where we have been able to vaccinate folks to a decent degree, as close to herd immunity as we can get. Once you start to see a spike in cases, that's a signal to say that it's likely a good idea to get boosters in people's arms so we can keep those cases down and protected. So there's a lot of information that goes into it. But yes, we do anticipate boosters within the six month to 1 year out period. And I do think that's wise. Having said that, I do believe that we must keep in context the fact that, 60% of folks in North America have been vaccinated compared to just under 3% in Africa. That degree of inequity is just not okay. So while we're looking at things like boosters and being concerned with what we can do at home, it is important for us to level the playing field, because this is a global society. There are folks who are traveling all over the world, and whether or not you care about global equity, it will come back home with that degree of inequity and with variance in play. And so I think that has to be considered with the conversation as well.
I want to follow this thread with you for one more moment. 3% you said in Africa. According to the World in Data, 10% of the global population is now fully vaccinated against the virus. Are we moving fast enough in our global vaccination efforts?
For me, no, Lana. And I say that from a professional place, but from a personal place. My mother lives in Zimbabwe. My sisters do too. I had to make the decision to inform them that they should get the Sinopharm vaccine that is from China, one that does not have as robust data as what we have here in the U.S. And it's painful. I'm afraid for my aunts. I'm afraid for my cousins. The inequity, those numbers that I just gave you, 3% compared to 60% are unacceptable. Anyone with a heart should not feel good about that. And I say that because we have the resources. Even after we vaccinate every person that wants to be vaccinated, we have an excess of doses that are just sitting in most, including our own country, high-income countries in the world. So we can no longer accept that. There have to be short-term measures, donations of those vaccines, and kudos to the Biden-Harris administration, who have made the largest known donation right now. But there's more to give. There's raw materials. There's the conversation around lifting of patents. There's the conversation around manufacturing hubs around the world that will enable all of these areas to be able to sustain their own manufacturing. But that has to start with the leaders and the countries that have these resources. And let me be clear, I'm still not advocating for taking away from any American. I am saying we have excess, and where we have excess, where we have capacity, we must give. And so I do not think we're going fast enough, but that the conversation at the G7 were a great start.
Dr. Hlatshwayo Davis, always appreciate our conversations and appreciate all that you do. Thank you.
Lana, it's always a pleasure. Thanks for having me back.